for many Nigerians, falling sick is not just a health challenge, it's a financial burden. As the cost of medical care rises due to economic downturns and declining living standards, millions are left struggling to access quality health care. Adamu Imam has a situation report from Bauchi.
In Nigeria, most people pay for medical care out of pocket, with little to no government support or affordable insurance options. For low-income households, the choice is often between self-medication or delaying treatment until their condition worsens, sometimes with fatal consequences. At public hospitals, patients share their struggles with accessing affordable care. It is the duty of the government at all levels to provide accessible healthcare facilities that are affordable, while also seeking ways to improve them. The last time, I suggested an initiative where people could pay a certain percentage of their medical bills. I advised the government to act appropriately and in a timely manner. All we hear from the media are promises that they will do this or that, but it often turns out to be mere rhetoric. God is powerful, and the government will be held accountable for their actions. The issue of free medical services in Nigeria is nothing but a mirage. We can hardly see what is truly happening in our public hospitals. I speak from experience because within just 2 months, I often find myself needing to visit the hospital due to our children requiring medical attention. The so-called free service is no longer available at all. Beyond individual experience, the broader healthcare system faces severe challenges. Public hospitals are overwhelmed, medical supplies are often scarce, and many health facilities lack adequate funding. Health advocates and medical professionals warn that without urgent intervention, the crisis will deepen.
First for some little amount for antenatal, that's for Pasolate and folic acid. Even though the Pasolate and folic acid is free, but they are collecting some little amount, which is 300 to 500. Now that for deliveries, hospital delivery is free, but there is some little amount attached to it. A lot of women are crying for why they are collecting such amount, or why the facility are demanding for such amount.
For under 5 children, they give them free treatment for malaria and the rest. But any other thing, you have to pay for it. So out-of-pocket expenses is very high on the part of people when they go to the hospital. Even cat, you have to buy cat. Investigations, you have to pay for investigation. And that is where the money is. And then for drugs, if they can give you generic drugs, but other drugs you have to go and buy. Even now that they say we are now doing the Bauchi State Health Contributory scheme, you have diseases that they don't cover.
To pay, or they may refer you to that facility where you can access, or when you can access those care. So that's how it was. Some people come to say, why am I asking me to pay? Why are you telling me the drug is not covered? Is it because what the money that the government is paying is not enough? But area of improvement is finance. Government should improve the finance, and they should also checkmate the HMO, because most of them, the HMOs, they are business people. They are business people. When you request for request for an investigation, and they will tell you that investigation, they will look for a way to delay it, because they themselves, they don't want to spend that money.
Looking ahead, experts stress the need for government action, expanding health insurance coverage, increasing investment in public hospitals, and making medical care more affordable for all Nigerians. Without these steps, the country's healthcare system will continue to leave its most vulnerable behind. Adamu Imam, Trust TV News, Bauchi.